of Medicine. This video will be about testing of upper and lower extremities. In this, we will be testing involuntary movements if there are any present, the muscle tone, the muscle strength, and also the body position. So, hello Darshan, how are you feeling?
I'm fine.
We will be testing your muscles from upper extremities and lower extremities. There will be little discomfort. Is it okay?
Okay.
So let's begin. Pause. Now observe the body position in rest and in movement. In rest, it is looking okay. In movements, flex your thigh. Okay. So check for any involuntary movements such as tremors, tics, chorea, or fasciculations. Note their location, quality, rate, rhythm, and amplitude, and their relation to posture, activity, fatigue, emotion, and other factors. To check the muscle bulk, we have to inspect the muscle and contours of the muscle. So, starting with the shoulder, forearm, arm, forearm, hypothenar and thenar eminences, thighs, and legs. So, while checking for the dorsal intracerat, it is normally full and slightly depressed. And while looking for the hypothenar and thenar eminences, it is full and convex. To test the muscle tone, when a normal muscle with an intact nerve supply is relaxed voluntarily, it maintains a slight residual tension known as muscle tone. So, if you ask the patient to flex, extend, you will be feeling the slight tension, which is you will call the muscle tone. So, if you go for checking for the legs, keep one hand on the thigh and other on the legs and try to flex and extend. You will feel the slight muscle tension remaining. So while testing the muscle strength, it is usually you asking the patient to resist against your pressure. So in this, the factors matter are age, sex, and the muscle training. Also, mostly the dominant side is more stronger than the non-dominant side. That is, it can resist more precisely than the non-dominant side. Also, make note of this. That is, the muscle which is shorter is more stronger, and the muscle which is longer is the most weakest. To test the flexion at C5, C6, that is the biceps, ask the patient to flex his arm and hold one of your hand here and hold the other one here. Darshan, can you pull it against the resistance? Okay. Now, for the extension of the hand, ask the patient to extend it against the resistance. Okay, thank you. For testing the extension at the wrist, ask the patient to make a fist. Darshan, I will be giving you pressure. Make sure you resist it. Here we are testing extensor carpi radialis longus and brevis muscle. Okay. To test the hand grip, that is C7, C8 and T1, ask the patient to squeeze two of your fingers as tightly as possible. To avoid injury, make sure you put your middle finger on your top of your index finger. Now, Darshan, press hard as possible. Okay. Now, do it on both the sides. By doing it simultaneously, you can compare the right grip and left grip. To test the finger abduction, that is C8, T1 and ulnar nerve. Ask the patient to abduct your fingers. Now, instruct the patient that you should not move the fingers and try to resist them as far as possible, because we will be applying pressure on the sides of the fingers. Now, to test the opposition of the thumb, that is C8, T1 and median nerve, ask the patient to fully extend the fingers and touch the little finger against your resistance. Also, with the other hand, support the wrist of the patient. To test the flexion at the hip of the iliopsoas muscle, place one hand on patient's mid-thigh and ask the patient to raise the leg against your hand. Darshan, can you raise? Walk straight. Test the adduction at the hips L2, L3, L4. Place your hands firmly on the bed between the patient's knees. Ask the patient to bring both the legs together. To test the abduction at the hips L2, L4, L5 and S1, the gluteus medius and gluteus minimus. Place your both the hands firmly outside the patient's knees and ask the patient to spread both the legs against your hands. Darshan, try to spread your legs. Bas. Test the extension at the hips, the gluteus maximus, which is supplied by the S1. You have to ask the patient to push the mid posterior thigh down against your hand. Darshan, can you push it against my hand? Okay, relax. Test the extension at the knee, that is L2, L3, L4, the quadriceps muscle, which is the strongest muscle in the body. You have to place one hand near the ankle and the other hand supporting the knee. Ask the patient to extend the knee against the force you are applying. Expect a forceful force. The flexion at the knee, that is L4, L5, S1, S2, the hamstrings muscle. As position the patient's leg in the flexed so that the knee is flexed with the foot resting on the table. Now tell the patient to keep the foot down as you try to straighten the leg. Foot dorsiflexion, which is mainly tibialis anterior, that is L4 and L5. Ask the patient to pull up against your hand. The plantar flexion, which is mainly done by gastrocnemius and soleus muscle, which is supplied by S1. Ask the patient to push against your hand.